The paired maxilla form the majority of the viscocranium and upper jaw, contributing to the formation of the face, nose, mouth, and orbit, and housing the maxillary paranasal sinuses and nerves of great importance for local anesthesia. The maxilla plays a vital role in mastication and communication and articulates with 9 bones. The frontal, zygomatic, palatine, and alveolar processes, as well as the body, which contains the maxillary paranasal sinuses, and make up the bulk and projections of the maxilla. The body of the maxilla has orbital, nasal, infratemporal, and facial surfaces. Extending anteriorly, each frontal process articulates with the frontal bone, forming the medial orbital rim. The infraorbital foramen is a landmark for the infraorbital block. This anesthetizes the teeth from the central incisor to the premolars, including the mesiobuccal root of the first molar. Inferior to the infraorbital foramen is the canine fossa. The facial ridge over the maxillary canines, the canine eminence, is the landmark for the anterior superior alveolar block. Anesthetizing this nerve blocks the maxillary central incisors to the canines. Posterior to the canine eminence is the site for the middle superior alveolar block, which is administered superior to the maxillary second premolar and anesthetizes the maxillary premolars and the mesiobuccal cusp of the first molar. The maxillary teeth are covered by the alveolar process of the maxilla, which is less dense than the mandibular, allowing more successful diffusion of local anesthesia. Differing densities of the maxilla determines the pathway of infections and abscess formation. The thinner facial surface of bone indicates the easiest area for bone fracture if needed during extractions. The alveolar process can undergo resorption. Each zygomatic process of the maxilla articulates with the zygomatic bone, completing the infraorbital rim. On the posterior portion of the body of the maxilla is the maxillary tuberosity. The maxillary tuberosity and posterior superior alveolar foramina are landmarks for the posterior superior alveolar block, which anesthetizes all maxillary molars and adjacent buccal gingiva, with the possible exception of the mesiobuccal root of the first maxillary molars. Inferiorly, each palatine process articulates with the other at the median palatine suture. In the anterior midline between the palatine processes of the maxilla is the incisive foramen. The soft tissue bulging over the incisive foramen is the incisive papilla, which is a landmark for the nasopalatine block, anesthetizing the maxillary palatal gingiva from canine to canine. The greater palatine foramen, posterior to the incisive foramen, is the landmark for the greater palatine nerve and maxillary division block. The greater palatine block anesthetizes the palatal gingiva and mucosa from the maxillary first premolar to the posterior portion of the hard palate to the midline. The maxillary division block is aimed into the pterygopalatine fossa, anesthetizing the maxillary division of the trigeminal nerve. Due to the close relation of the roots with the maxillary sinus floor, there is potential to break away the bone, separating the oral cavity from the sinus during extractions, causing oro-antral communication. Additionally, maxillary sinusitis may occur when bacteria from infected tooth pulp can populate and travel to the maxillary sinus. As seen, the maxilla is very important clinically and plays a major role in many daily functions like talking and eating.